The COVID-19 pandemic was more than just a global health crisis. It was a wake-up call. Suddenly, the world became acutely aware of just how fragile and interconnected our health systems really are. We watched as a microscopic virus brought countries to their knees, straining hospitals, shuttering economies, and transforming daily life. The pandemic exposed long-standing vulnerabilities and made it clear that we need to think differently about how we confront the threat of infectious diseases. At the heart of outbreak prevention is an understanding that pathogens are constantly evolving. Viruses such as influenza and coronaviruses are masters of mutation, shifting and adapting through the relentless forces of natural selection. Zoonotic diseases, those that leap from animals to humans, form a particular threat. Encroaching urban sprawl, relentless deforestation, and the global trade in wildlife create more opportunities for these dangerous jumps. Human activity is part of the problem, setting the stage for new viruses to emerge where our worlds overlap with that of animals. The ways that people live, travel, and connect have an outsized impact on how quickly and widely diseases can spread. International travel can carry a pathogen across continents in hours. Meanwhile, digital platforms, while vital for communication, also act as megaphones for rumors and misinformation, undermining response efforts and fueling fear or complacency. Complicating this landscape further are changes in global climate patterns. Warmer temperatures and shifting weather alter the habitats of mosquitoes and other vectors, pushing diseases into areas previously untouched and reshaping the map of vulnerability. Yet, in the face of these challenges, we are witnessing a revolution in disease surveillance and preparedness. Technological advances are providing us with new tools that could make governments and scientists not just reactive, but genuinely anticipatory. Genomic sequencing, once a laborious undertaking, now allows scientists to read the genetic codes of viruses with unprecedented speed and accuracy. By tracking changes in these blueprints, researchers can watch a virus evolve almost in real time, identify new variants, and refine strategies for vaccines and treatments accordingly. Artificial intelligence and machine learning are moving to the front lines of public health. Algorithms can sift through immense data sets, from online search trends to hospital records to travel itineraries, uncovering subtle signals that may indicate the start of an outbreak. These systems can alert authorities to act before a disease gains a foothold, buying precious time for containment. Ambitious global efforts, like the Global Virome Project, are seeking to move further upstream. By surveying wildlife for unknown viruses, scientists can identify potential threats before they ever reach humans, making it possible to predict and prepare for what might come, rather than merely respond to what has already arrived. Data sharing and international cooperation are proving critical. Open access platforms allow scientists from around the world to pool data and insights, breaking down barriers that have historically slowed progress. This spirit of collaboration extends outward to the public as well. Wearable devices and smartphones, now nearly ubiquitous, can help track outbreaks at the individual level by picking up early changes in biometric health signals. Wastewater analysis allows for community-level surveillance, detecting viral remnants before anyone visits the doctor. None of this innovation erases the fundamental challenges. The pandemic illuminated the limits of technology in the absence of strong political will, robust health infrastructure, and public trust. True preparedness demands more than hardware and software. It requires resilient, accessible healthcare systems, leaders willing to act transparently, and populations that understand and trust science. Addressing ethical issues, ranging from privacy concerns over health data to the equity of vaccine distribution, will be essential to building systems that are both effective and just. Our world is more connected, and paradoxically more vulnerable than ever before. The path ahead will be shaped not only by our scientific ingenuity, but by our ability to work together, communicate openly, and keep humanity at the heart of our response.